Celebrities like Kim Kardashian, Iggy Azalea, and Nicki Minaj have influenced millions by cementing the popularity of a curvy, round backside, which has caused butt enhancement procedures to soar in popularity. Now, we've been warning about this dangerous surgery trend on the show since it emerged, but now one phenomenon has become so shockingly dangerous, it is being called the #1 most deadly plastic surgery in America by medical societies. The surgery is so popular on TikTok that hashtag BBL, Brazilian butt lift, now has over 3 billion views. Everyone seems to be talking about and getting Brazilian butt lifts, the fastest growing cosmetic surgery in the world. This top-rated California doctor is booked for BBL surgeries all the way into fall 2022.
Over the last 5 years, it's probably become one of the most popular procedures. It used to be about breasts in the States, and now really the focus has changed down to the bottom.
In the US, butt augmentation is professionally done 2 different ways: by fat transfer, that's BBL, or by implants. And then there's the illegal way to double the derriere, black market butt injections, which we've been exposing here on the show for years using hidden cameras.
Could you close the door?
Yeah, sure, totally.
That's an illegal butt injector telling us to close the curtains. We met her at an airport hotel room and taped her undercover.
When I first got my very first session,
She told us what happened after her own injections.
I leaked, which is normal for like the first 2 days, because it's a foreign substance going into your body.
Singer K. Michelle spoke out on our show about what happened to her after an illegal procedure.
It was like discoloration, it was pain in your back, it was migraines, it was super discomfort.
The doctor who removed her injections was horrified by what he found in her body.
It's foreign, obviously, and you can see it. I mean, she's got thousands and hundreds of thousands of these.
From injections and implants to BBL surgery, named the #1 most deadly plastic surgery. Today, the story behind procedures making headlines for all the wrong reasons. Joining me is board-certified plastic surgeon and former member of the New Jersey State Board of Medical Examiners, Dr. Arthur Perry. He's been speaking out about these dangerous procedures for quite a while. In fact, you made it your mission to persuade more people not to pursue these risky procedures as you deem them. And you've gotten forceful about this. You actually joined forces with Jada Pinkett Smith to sound the alarm. I saw that piece. It was fantastic. Got a lot of people thinking differently about it. But what I don't understand is why you're so passionate about this. This is a procedure that is still being done by lots of plastic surgeons.
It really is. But you know something? People are dying with this procedure, Mehmet. Not by the dozens, but by the hundreds. No one should die with cosmetic surgery, right? Everybody knows that. It should be safe. We should look good after the procedure. I'm so happy that you're doing this piece to educate people so people can stay safe with cosmetic surgery.
Let's walk through how this all works. On the tape piece, you saw us mention a couple of these different types of butt enhancement. There are 3 ones we're going to cover today. The first category is buttock injections. So what are the risks people are taking when they get in these buttock injections? And walk us through, I guess there's a couple different categories.
You know, almost anything you can buy at the grocery store or at the hardware store is being injected into buttocks now, by doctors, but by a lot of lay people. So they're using hydrogel, which is not really legal in the United States. They're using methyl methacrylate, polymethyl. That's crazy glue. Yeah. They're using silicone, which causes all sorts of scarring in the buttock. And they're using unbranded things. That's what you buy at the grocery store, at the hardware store. It's really just terrible. Lots of these things are being done, and patients are dying all over the world.
Next, there are butt implants, which should only be done by a board-certified surgeon who hopefully has performed many of the procedures safely. But there are a lot of scammy people doing these in secret, which can lead to terrible botched procedures, like the one someone posted on YouTube.
This is my implant flipping backwards. I don't think an implant's supposed to do that. It shouldn't be able to flip.
I mean, that is horrible, Dr. Perry. What went wrong with her procedure?
Well, a silicone buttock implant is actually a very difficult procedure to do correctly. This implant has to be placed within the muscle, so underneath the fat. In that video that we saw, it looks like the implant was placed under the fat and over the muscle. These can move, they can get infected, they can flip like that. The complication rate is probably 1 out of 3 with these implants.
1 in 3 people has a problem?
Yes.
Why do we use them for the breast so often?
In the breast, they're much safer. They're smaller and they're behind more tissue. Here, it's a very difficult technical operation for plastic surgeons to do.
Yeah, the buttocks muscle is not easy to play around with.
No, and it has to be split to do this
And you're
right.
sitting on it, so you're continually pounding on this implant, which is if it's in your breast, hopefully you're not banging your breast because you don't sit on your breast.
That's right, and that's why this hurts, and a lot of people can't sit on their buttocks after having a buttock implant.
All right, now the Brazilian butt lift, which is also known as a fat transfer, and people call it butt injections, referring to the fat injections, but it's misleading. So let's go through exactly what is done to do a Brazilian butt lift and why these became so popular.
Well, this is a poorly named procedure because it's not really a butt lift. But here's what we do. We use, this is called a liposuction machine, and we suction fat with this. I want you to bend over. The surprise is I'm going to be doing it on you today. So we take this machine, we go back and forth, and we harvest fat. And it looks...
So you infuse fluid, you get the fat out, the fat goes in these tubes, and it looks like this.
That's right.
Okay.
And then we process that fat. We clean it up a bit, and then it looks just like this.
You spin it up and you centrifuge it, and
that's right. We get
like
the blood out.
Yeah, it looks like almost a jelly consistency here.
Right, and then we take our patient here, who is a willful chicken, and we go ahead and we put the fat under the skin and over the muscle, and that's what we need to do. If we put it in the muscle, we're in trouble. And that's where a lot of the problems have occurred.
And I don't know if you can all see this, but you're starting to see this area, this breast is plumping up, and this one is not. Now, there's a little leakage here, which is one of the potential problems, right, if it comes leaking out?
That's right. And we put a lot of this fat in, and a lot of this fat doesn't survive. So we might put a liter in, and maybe a couple hundred cc's survive.
What happens to the stuff that dies?
It looks terrible. It becomes oily cysts. Your body takes care of it. It scars. It doesn't look good. So with this particular chicken, it's getting bigger, and this takes about 1.5 hours to 2 hours to do this procedure in the operating room.
Because you're infusing multiple parts of the buttocks with this fat.
That's right. We're going in different spots. We used to go into the muscle, and that's where the problems have occurred. Going into the muscle, there are these very, very large veins in the muscle. So veins as big as this, and you can see this is a typical cannula, we call these, that I infuse this, that I inject the fat in. It can very easily go into this straw, which is 6 millimeters, which is the size of a typical vein in the buttock. So it's very easy. I do that, I inject accidentally, and we've got some problems as that comes through. Because there it is, going into the vein. It doesn't take a lot to kill a patient.
And this would all, once it goes into the veins, fly to other parts of the body, which I'm going to cover in a second. So you've just shown us the massive impact it can have on a chicken breast, like in a woman's buttocks, but there's material leaking out, there's material infused in the wrong layer that can cause scarring, and you've got the possibility you can get into the veins and go places you don't want it. All right, after this commercial break, we're going to meet a woman who had a BBL, Brazilian butt lift, and this was their result. Look at that, guys. Find out what she wants you to know. Welcome back. Today we are exposing the real risks of illegal and botched butt enhancement procedures. The Brazilian butt lift, or BBL, has taken over social media. It is being called the most dangerous plastic surgery in America, something my guest Lauren did not know until it was almost too late. Take a look at the video she posted in the days leading up to her surgery.
7 more days. 7 more days. Well, technically 8. Until my surgery. And I am so excited.
So joyful. Then, after the surgery, things took a turn for the worse. Take a look.
All I can do is thank God that I'm alive. They did give me my results back for the infections.
Lauren's surgery was botched. Here's what she ended up with. You can see there's modeling and discoloration. Luckily, though, Lauren survived and is here today along with my friend, board-certified plastic surgeon, Dr. Arthur Perry. Lauren, let me just get it out of the way, this key question. What made you want to get a BBL procedure?
Well, I had my daughter in high school, and I always dreamed of having this perfect body, this dream body. And I looked online to see what type of surgeries that I can get. And one of my friends had told me about a surgery she got in Mexico, a Brazilian butt lift. So I researched the company to find out which one it was, had a consultation. It was really quick and easy, sent pictures over to them and put my deposit in to go get the surgery that I had been dreaming of.
So tell us what happened the day of the procedure. Any red flags?
Honestly, I was so excited about getting the surgery that I didn't even think of the red flags that were there before I even put my deposit down. And one of those is that I didn't know who my doctor was until I had the actual surgery. And I didn't get a chance to research the doctor to find out, you know, if he had any deaths on his name or anything like that. And the day of, the anesthesiologist came in, gave me something to make me woozy. And it was then when I met my doctor, and still to this day, I still don't know who my doctor was. I was put to sleep quickly after that. And when I woke up, they gave me a shower, and they sent me home a couple of hours after, which I had to take an Uber to close to the border. And I had to get wheelchaired back to the United States. And 2 weeks after that, I had to get emergency surgery due to having a staph infection and 2 bacterial infections.
So, Dr. Perry, what could have gone wrong during the procedure? How could all these complications amount from a plastic procedure?
Well, this is just terrible. Now, first of all, she never met her doctor before the surgical procedure. That's crazy. You need to have an hour consultation before any surgical procedure for her benefit and for the doctor's benefit. And of course, in the operating room, she had a lot of surgery. She had the Brazilian buttock lift. She had a tummy tuck. She had liposuction. A lot of time in the operating room. The longer we're in the operating room, the more likely we are to have a complication. Afterwards, she was told to shower very soon after surgery. You know that we don't have patients shower at least 24 hours, if not longer, if there are drains in after surgery, because that's an avenue for infection. Then she went home the day after surgery. Crazy. She should have been hanging around the area with the doctor for at least a week, if not 2 weeks, if she's having surgery in another city. She went home. She had no preoperative teaching. She used a heating pad on her belly. The skin of the belly is very fragile for months after surgery, and she burned herself. And it's not her fault. She wasn't told she couldn't do anything like that. And that set things up for a terrible infection. She's lucky she survived.
Lauren, I am speechless seeing all the complications. I appreciate you coming on to share that with folks at home. Arthur, in particular, you're worried about people going overseas for these procedures. And, you know, you're not going overseas to go to Mexico, but it's still in a different country with different rules.
And you can't communicate with a lot of people. It's a different language, right? And what happens if you have a complication afterwards? She was wheeled to the border, and a friend picked her up in the United States. When she's in the United States, who is going to take care of her if she had a complication, which she did? Plastic surgeons in general don't want to take care of patients that they haven't operated on. There is liability without getting any of the fees, let's be honest. And so a lot of patients have a hard time finding a doctor to take care of them elsewhere. It's one of the reasons she had to stay down there for a longer time.
There's another reason, Lauren, that BBL is risky. I'm going to share this with you. Thankfully, this did not happen to you because it could have killed you. So let's just go inside what happens with a butt lift. And it starts with the anatomy of the butt. So I'll show you inside of your buttocks. There's a couple of key structures. There is the muscle, which obviously we're going to show you. You can actually make this bigger, which is the best way to make your butt look good, right? Then there's the fat around the muscle. And there's a third structure, a really important one, the veins that bring all the blood to and from there. Now, these veins are quite large. When there's material injected into the veins, like these little fat lobules of gray you see with the blood cells, they form clots. They go up into the heart, into an artery called the pulmonary artery, which goes to the lungs, pumping these little clots to your lungs, and they cause lots of little bruises in these different structures. These tiny pieces of material cause emboli. You've heard of pulmonary embolism. These block the proper oxygenation to your lungs. You can't breathe. You literally suffocate to death. And there's no wonder that major plastic surgical societies who are witnessing lots of deaths from these procedures have made urgent warnings against the BBL surgery. So, Dr. Perry, no one should die during plastic surgery. Why are these procedures still being done?
Well, they're still being done because they are legal. And some doctors are doing good jobs, but a lot of doctors are not. Do you know that 3 20% of board-certified plastic surgeons have had a death with this procedure. That's an astounding statistic. We think that as many as 1 in 3,000, some people think it's higher, our patients are dying from this procedure. Why should it be done now?
Lauren, what do you want to say to someone considering getting a BBL?
I want to say to really think twice about this. I feel that I'm very blessed and lucky to be alive. Do your research and really understand what you're getting yourself into. I know a lot of people we see on social media and on Instagram, these perfect bodies, and we want to look a certain way, but it's not worth your life. I have a daughter who, you know, looks up to me, and she could have grown up without a mother because of a choice that I naively made. So really think twice.
Lauren, thank you so much for coming on the show and sharing this story, as painful as it is for you. Good luck going forward. Dr. Perry, we started working together. Actually, we co-authored a book, You, the Owner's Manual, Being Beautiful, which is a New York Times bestseller. I've respected your work. Obviously, working with someone on a book, you learn a lot about them. I thank you for stepping up, taking personal risk, and speaking about the problems of these plastic surgical procedures.
Thank you for having me. Thank you for educating the public about this important topic.
Now, when we come back, we're going to talk about a procedure that I think folks would want to know a little bit more about, which is how to build up your butt. But give us an idea. How much of a butt expansion can you get if you just do the right exercises?
Squats. They're tough, but you can do them. You can actually increase the size of your gluteus maximus muscle. That's the name of it today. The gluteus maximus by 35%. And you know what? It's a lot safer than having this surgery. It really is.
So if you're considering the procedure, then do your homework. Speak with more than one board-certified doctor, and then find the one that you trust, and then talk to their patients. It's worth it.